Hey everybody, welcome back to Founder Fridays with DivInc. My name is Naisha Brown and I am your host for this weekly series. Today I have the honor of sitting down with Adrianna Cantu, who is the co-founder and CEO of Revealix. We're going to learn all about this amazing company today. But what I can say is that Adrianna is doing some amazing and innovative work around digital health and health equity. And so that's what we're going to get into today. Welcome, Adrianna. Thank you for joining us.
Great to be here. This is a fantastic opportunity, so I'm ready to get started.
Well, let's get straight to it. Before we get into the questions that I have for you today, though, I wanted you to first introduce yourself, give us some background about you, let us know what you were doing before you became a startup founder, and then we'll go from there.
Sure. So my background, I'm the founder and CEO of Revealix. We're a digital health company that's focused on helping people with diabetes avoid preventable wounds and amputations. And we focus first on the provider side. So we have a solution that I'll talk about later. It's a digital health imaging platform that runs on a mobile device. But my background is clinical. I am, by training, I'm a physical therapist, but my area of expertise has been in wound care. So I'm board certified as a wound care specialist. And that was the very beginning of my clinical career. I've been a clinician on the front line. I'm based here in Austin, Texas. So I spent a lot of time in what was the trauma center at that time, Brackenridge Hospital. And then from there, I went, after a number of years, went into another role, which in retrospect was a startup. And so that didn't know that. I just kind of followed my friends and we did really great things. But I think that's really what led to me doing this startup, because it was that company was probably number 20 or 25, and over 10 years my responsibilities grew and grew because I was able to really be the chief architect of building things from the ground up. And at the end of my 10-year stint there, we had 200 clinical specialists throughout the country. We were providing tons of wound care support. And I knew that everything that we had done to sort of drive best practices through human capital was never going to be enough to meet the needs of the patients, not just here in the United States, but what I knew was happening worldwide. So that really led the idea that we could use software to actually reach even more people. And that sort of led me to form this company.
Awesome. So let's get into the nitty gritty of what Revealix actually is. You're alluding to it a little bit, but let's put out some.
Yeah. So what we're doing is so again, my background is wound care specialist. So one of the things back when I started my career, you see patients come in that are presenting with very advanced stage diabetic limb disease, and the evidence was clear then. That nearly 85% of the wounds that we were seeing are preventable. So globally, the state of the state of this problem is so massive. It's really, I say, we have a global, national, and public health crisis at our feet. Every 20 seconds, someone loses a limb to diabetes. So when you think about that, 85% of those are preventable by one of the most important things is having the foot looked at. So a foot inspection. And that picks up on the subtle changes that are happening in foot health. Well, that is actually not very modern. And so that is a very subjective and archaic process. So the gap to close is how do you actually bring the evidence into the front line in a way that is repeatable and consistent enough that it can be done at scale? Because we have 34 million Americans with diabetes and only 1 in 4 is getting that foot check done. So you can think of all the risk, the complications, all that cost just escalating. So what Revealix is a smart thermal imaging. It's a mobile imaging platform. It's the only one that's designed to be non-contact, non-invasive, mobile, in real time. So we help pick up on risk that is immediately present at the foot, and then we do a risk stratification module that helps to predict who's at risk for developing a wound in the future. So in doing that, we can help the providers conduct a valid foot check to get ahead of these complications.
Yeah, and preventative care is what I'm hearing you say. It's really important to, if 85% of them are preventable, why do you think the science hasn't caught up yet.
That's in the gap. No, and that's what's actually, your questions, it's really, so our tagline is like to simply save limbs. And that simply meaning we know the evidence. I knew the evidence back when I started my career of how to prevent it. It was just very hard to do because it's such a subjective thing of one person. I'm a specialist. When I look at a foot, I can see all the signs and symptoms of concern that are risk features. Well, now we can develop, computer vision aided software that can recognize these risk features, recognize the temperature changes that are meaningful. So now you have a way to automatically and objectively capture that right at the point of care where it needs to be. And by the way, because we've really focused on making it accessible to the patients that are most at need, and that means communities like where Hispanic communities, Black communities, this is where the solutions need to be. So when we innovate for health equity to reach those communities in a way that is practical to actually make a difference there. So I know for as far as my team and what we've been working on, it is so important that we run towards that community with innovation.
Yes, I couldn't agree more. And you said a key word here is practical. So can you talk about the what this product actually looks like? How can it be brought to the communities that you're referring to now?
Yeah. So when I say practical, it's one of my favorite questions. Honestly, we didn't plant this, but the thing that's practical is you can over-engineer a solution to then make it such that it is too expensive, too bulky, and it's just never going to be where it needs to be. So I go back to my roots, starting at the trauma hospital where we served the 7 counties, and a lot of the community was underfunded or non-funded. And so the reality is that innovation needs to reach them. That's practical enough that it can be in the everyday point of care and be nimble enough that it just requires a smartphone, and our software is on here so that it can be used also in the home environment. So it's the ability to transcend the realities of healthcare today, that it needs to be where the patients are in a way that is accessible to them. We can be at the community church. We can be in the clinics that are all throughout the community. So it's kind of like the way that I see it, it's the vital sign monitoring solution for the diabetic limb. And that's what Revealix is here to do, is to bring that to life.
I love that. Thank you so much for sharing about that. I want to shift a little bit and talk about the transition you experienced from being in this executive role within the industry and then becoming a startup founder. What was that? I know you said that it was kind of like a startup when you started, but it morphed into this more executive position.
Yes.
Right? So what was that transition from going from this executive leadership role to being a startup founder?
It's interesting because maybe a lot of people who know me now and have known me back then, is like, I'm kind of working in the same mode. This is how I work. When we were started in the other company, it was an opportunity. There was so much that I could see that needed to be done to drive, efficiencies, to create this infrastructure that could repeatedly drive the outcomes, the clinical outcomes we wanted, but also to meet the business outcomes. So it's no different than in any other company and in the way you think of solving a problem. So I had the benefit of that executive opportunity. So I was vice president of the clinical operations there, and really saw from the beginning, built that entire curriculum up. So when you translate that to startup, it was like, well, here we go again. Let's figure out the problem to be solved is that the ability to actually get a valid and rapid foot check done is hard. And it needs to be much simpler. So here we go, simply saving limbs. So you start to think about all of that behavior that allowed me to be successful in my last role. And those behaviors were, we didn't have a marketing team. We didn't have a support team. You had Google. And then you had grit, and you had, a fire to solve this in a way that you knew could be done. So what I did at that company is kind of what I'm doing here. So the executive opportunity was me being in a position to actually, take hold of something big and see it through. So this early stage of building something is, I think, really what lights my fire. And this is a lot harder than I thought it would be. So to be frank, I mean, you're going to take on healthcare. Call me. I'll talk. Make sure that you know what you're signing up for. But it's very powerful to see how far we've come, and it hasn't been the straight path, but it's definitely beautiful to see where we are today.
So you just kind of alluded to one of the other questions I was going to ask you. I saw in a previous interview you did. You said that, I'm going to be paraphrasing a little bit, but you said that the fuel for your entrepreneurial engine has to come from within. Can you talk about what your fuel is? What keeps you going with, how it's difficult to run?
Yeah. That question goes pretty deep because I've had to, ask myself, what are you willing to do to see this through? Mm-hmm. And so I think it's very easy for me in one way that what I'm motivated by is the challenge and the problem. From the day one, my vision for this company has not wavered. I have seen it as clear as day from day one. Now it has taken me years to see it through. But on that journey, what I am fulfilled by and what drives me and my fire comes from the people along the way that have been there for me, like DivInc, like those friendships. It is like fighting a battle. I mean, I've not been in the military, but it is like fighting something. There's a mission here, and to have the people who are going to be willing to stand by you, besides you, be your allies. I mean, it is so fulfilling, but you realize it's an enormous responsibility that you take on as a founder to say, here is the vision that I see and the promise that I want to deliver. And that is the opportunity for people to be able to simply save limbs, that this is possible. There is nothing that I can see that says it's not possible until the universe tells me. So it is this underlying, hey, if it's not going to happen, you guys tell me. But so far, we're still making forward progress, and the product is now, in practice in our beta release. So this fire, I think, comes from a place deep within. It's just the way I'm wired to solve the problem and see it through. And if something's going to stop it outright, that's fine. I will have given it everything I've had. But that's kind of what motivates it. The money's maybe one day, but I'm doing this because it's what I believe is possible, and that's something that I can contribute to my industry and hopefully leave the world a better place. So for me, it's a legacy that I'd like to leave behind.
I love that. Thank you for sharing that. And so you were a part of our very first cohort for our accelerator program, and I would love to know what your key takeaways from that were. We just finished up our 8th cohort, so the program has grown a lot, and your company has grown a lot since participating in the accelerator. So what was your experience in the DivInc Accelerator like? And then what advice would you give to anyone who's on the fence about applying?
It's funny. So Preston and I knew each other before he created DivInc, but we knew each other because I was doing, this Revealix thing in healthcare, and he was like, "Oh, this is fantastic. How can I help you?" And that's what his role was. He was finding ways to help, founders like me who maybe weren't going to get that first, like being an underrepresented founder. So when at that time he started DivInc, so he was going through the interviews, and all of a sudden I was like, "Hey, I want in." And so it was like the last day. He says, "Really?" I said, "Yes. I'm doing great things, but look at what you're building. Look at that network, and look at this energy. It's like, I want to be a part of that. That is what would help fulfill, these other areas of need that I have for the company that I hadn't pulled together." So during the Alumni 1 cohort, it was fantastic. I mean, the curriculum has even, gotten better and better. But at that point, it was a wonderful chance to be in front of mentor ally who were intentional about trying to help me and my company grow. And they have been as authentic as ever from day one. And so over these years and these different alumni, my DivInc family has grown. So to anybody who is thinking about, if you're on the fence about DivInc, you need to jump off And as you jump, like do like a Fred Flintstone and like get your feet in motion and just hit the ground running. And I promise you, like DivInc has this tremendous community of supporters. And my goodness, you guys have really done some amazing stuff over the last few years. So I'd be happy to do it all over again, always. But it's a family. It's a family. And so it's really been a part of my journey.
Awesome. Well, we would be happy to have you again. But
yeah. I'll wait. So I'll get this going and then come back and share my successes. But DivInc's been I can't imagine having come through this without you guys there. It's been really wonderful.
Oh, I'm so glad to hear that. Speaking of community and how important community is to sustaining yourself as a startup founder, what are some words of advice or encouragement that you would give to other women founders who are just starting out?
There's so many different ways to kind of think about how to help someone who's just thinking about it. But I think as a female in particular, and maybe this is just me, culturally where I came from, was to not, make noise, to basically, put your head down, work hard, you'll get recognized. And that's actually not served me well. And so I have had to learn how to be a little bit more outspoken. I mean, I was in operations before and I could talk to, 300 people all day long in a team, and that's easy. But to be the face of the company and to be the one that's making the decisions, you need to be able to be assertive, reach out with some intentionality to build relationships deliberately, but to think of the long game. So I think that if you are just starting out, is to really, really think about you're not going to have it all down. You're not expected to have it all down. You may be amazing at this part of being a founder, but you're going to have some gaps or areas that probably somebody can augment. So find those communities, find the network. There are so many talented and very generous people in Austin in particular who will sit with you, who will troubleshoot with you. But it's also another reason to think about programs like DivInc, because you now have ready access to people who are willing to step in and answer that question. That's been, for me, it served me so well. I am one chat away or email or call away from, solving something if I need to.
You're just dropping all the gems. I'm like making notes of everything you're saying.
Well, I've learned a lot. I've been through a lot of programs, and I think it's an accelerated learning opportunity for me as a woman. I've really enjoyed that part of the journey too.
Mm-hmm, definitely. So I wanted to save some room for you to share any updates that you wanted to let the community know about. If there are any ways that we can support you, let us know. And also let us know where we can find you in the world, in the interwebs.
Yeah, well, so what I'd love to say is we are, our product is now, we're on release 2. So we've got 2 versions of our software out that is being used in podiatry, wound care, and even primary. Endocrinologists are talking to us. So for any of you that have, contacts in those particular professions, please share a little bit about Revealix. Just that, hey, this is a great, smart thermal imaging. They can help you with preventing amputations and wounds in your patients. But that's one part of it. And we're always looking for introductions. We'll be fundraising starting in October. So that's another opportunity to participate in the opportunity that we have as the company. But then lastly is please, just support and be an ally for us. We're on Twitter. It's at Revealix. It's REVEALIX. And I'm Adrianna at ATX. So those are the 2 main ways that we try and stay in contact with our communities.
Awesome. Well, we will be sure to share that with our community and get the word out for you. Excited for our audience to see this chat because there are just gems left and right. So much good information that you shared with us. So thank you, Adrianna, for your time.
Thank you so much. Yeah, I appreciate it. I appreciate what you do. Yeah, I appreciate what you do. So let's do this. Keep doing it.
Yes, will do. Thank you so much.
All right, bye, y'all.